Welcome to this presentation on the Gram staining technique. In this session, we will explore the step-by-step procedure and its important applications in medical laboratory practice. Gram staining is a differential staining technique used to classify bacteria into two major groups, gram-positive and gram-negative. Developed by Hans Christian Gram in 1884, it remains one of the most important tools in clinical microbiology for rapid identification and diagnosis of bacterial infections. The principle of gram staining is based on differences in bacterial cell wall structure. Gram-positive bacteria have a thick peptidoglycan layer, which retains the crystal violet stain and appears purple. Gram-negative bacteria have a thinner layer and lose the stain during decolorization, taking up the counter stain and appearing pink. Thus, cell wall structure determines stain retention. The materials required for gram staining include a clean glass slide, an inoculating loop, a Bunsen burner, crystal violet stain, Lugol's iodine, alcohol or acetone as a decolorizer, safranin as a counter stain, and a microscope with oil immersion. Begin by placing a small amount of bacterial sample onto a clean glass slide using a sterile loop. Spread it evenly to form a thin smear and allow it to air dry completely. Proper smear preparation is essential for accurate staining results. Next, pass the air-dried smear briefly through a flame 2 to 3 times. This process kills the bacteria and fixes them to the slide, preventing them from being washed away during staining. Apply crystal violet stain to cover the smear and allow it to sit for 1 minute. This stain penetrates all bacterial cells. Afterward, gently rinse with water to remove excess stain. Add Lugol's iodine and allow it to act for 1 minute. The iodine functions as a mordant, forming a complex with crystal violet, which enhances stain retention within the bacterial cells. Apply alcohol or acetone briefly to decolorize the slide. This is the most critical step. Gram-negative bacteria lose the primary stain, while gram-positive bacteria retain it. Over-decolorization or under-decolorization can lead to incorrect results. Apply neutral red or safranin for 30 to 60 seconds, then rinse gently. This stains gram-negative bacteria pink or red, while gram-positive bacteria remain purple. Add a drop of immersion oil on the slide and place it under the microscope. Using the oil immersion lens, observe the bacteria at high magnification. Examine their shape, arrangement, and staining characteristics. Interpretation is straightforward. Gram-positive bacteria appear purple because they retain the crystal violet iodine complex. Gram-negative bacteria appear pink or red because they take up the neutral red or safranin counter stain. Gram staining has several important applications. It is used for rapid identification of bacteria in clinical samples such as blood, urine, and wounds. It also helps guide appropriate antibiotic therapy and plays a key role in microbiology research. Common errors in gram staining include over-decolorization, which may cause false gram-negative results, and under-decolorization, which may cause false gram-positive results. Other issues include thick smears, old cultures, and uneven staining, all of which can affect accuracy. In conclusion, gram staining is a fundamental technique in clinical microbiology. It provides rapid and reliable bacterial classification and helps guide treatment decisions. Mastery of this technique is essential for laboratory and healthcare professionals. If you have any question, please drop it in the comments section below. Remember to subscribe to this channel to enjoy more exciting videos.